Hey, welcome everybody. We are live today, and I'm talking about supplements. And with it being the new year, I know that so many people are out there learning about supplements, changing up their supplement stacks. They're talking to their friends about supplements. They're getting lots of ads for supplements. So today I really wanted to teach you and talk about how to choose the right supplement for your body. And I'm actually going to walk you through the protocol, the procedure that go through with my clients. So whether you are a practitioner, maybe you can learn a little bit of something and implement it into your own practice and how you approach patient care. And also, if you are somebody out there who is a consumer and you're looking to get more into supplements and add some new things to your stack for the new year, then today's video will be especially helpful for you because I'm going to really break down some steps that you can start to take. You can take notes on this today and really use it to empower yourself, do some more research, and really be able to um, get some more targeted therapies for yourself when it comes to your health, because that's why you're taking supplements in the first place, right? There's something going on that you want to address, that you want to adjust, and today's video is going to help you do exactly that. So I'm just checking on my settings here to make sure. Again, I am live today, so if you want to ask me any questions, say hello, go for it. I'm here. I'm going to be here for this video. So if you do have questions, drop them in the chat, because I would love to know, even right now, to open this with, what supplements are you taking right now? I would love to know, what supplements are you taking right now? Drop those in the chat. And again, any questions, go ahead, put them in there. I will be sure to answer them during today's live stream and give you a shout out. All right, so let's start with step one of how I start to approach personalizing supplements for people. Because what I find is that many people that come to me or ask me questions, like supplements is always the number one hottest topic that somebody's asking me about. And they usually are taking tons and tons of supplements, so many supplements. And when I hear about all the things they're taking, I'm like, oh my goodness, do you really need all those supplements? Do you require all of those supplements to be healthy? And I'm air quoting healthy because healthy means different things to different people. So there's always a reason why you're taking the supplements. Do you really require that? Do you really need that? And so before I give any recommendations, that's always where I start. Okay. And I want to know more about you and your history. So I want to know about medical conditions that you've had, past surgeries, what meds maybe you're currently on, what supplements maybe you're currently taking, your lifestyle, your diet. I want to know about all those different factors before we even go to the next step. Because why is this important? There are so many factors that influence how your body absorbs, metabolizes, processes nutrients. And one example I'll give, which is a really great example, is gastric bypass surgery. So if you're somebody who's had gastric bypass surgery, you've had part of your intestinal tract disrupted. It's not all put together how it originally was. Even somebody who has had maybe a colostomy bag or some type of surgery on their intestines, or large or small intestines, you will never be able to metabolize, absorb nutrients properly 100% because of that disruption. And that's why I really love IV hydration. And I'm going to get to that in today's video as an option for supplementation. But just to kind of preface and say, IV hydration goes directly into your bloodstream, so nothing is lost. And if you're somebody who has had gastric bypass or some type of surgery on your GI system, you could be taking all of these supplements and think you're going to be seeing all these results, and you're not, and you're wondering why. Well, that's the main reason, is because of that. And I don't think a lot of providers, practitioners are thinking about that or counseling patients around that when they come in with questions, mysterious symptoms, all of those things. And we're going to get into that in the next section. So I really want to know, do you have all your pieces and parts, your gallbladder, your kidneys, pancreas, again, intestines, stomach, esophagus? Have you had any problem surgeries? That's where we start. We really need to do a detailed assessment, because I'm not just going to throw a bunch of supplements at you and be like, okay, let's go. No, we need to get very detailed and figure out where do we start with all of this, okay? So next after that, after I know the assessment part, we're going to go to lab testing. And I'm not just talking about any old lab testing, okay? Because your regular provider is probably going to run the same old labs on you all the time. And I'm not going to get into a bunch of things about lab work today because I have done several videos on lab testing and how frustrating it can be because practitioners will run lab work and you'll just get like, okay, everything looks normal. I'll see you in 6 months or something. And you're like, but I feel like crap still. Like I don't feel good. Like I know something's wrong with me, but you're telling me all my labs are okay. It doesn't ever really add up. So the lab testing that I'm talking about specifically when it's pertaining to supplementation, wanting to know what's right for you, is doing micronutrient testing. I always start there. So really detailed micronutrient testing because it looks at all the vitamins, minerals, and electrolytes in your blood, in your body. And then we can take it a step further and look at food allergy and intolerance testing. Maybe look at some hormone function and then some inflammatory markers. This is kind of like the standard set that I run through when I'm working with clients. And again, if you're a practitioner and you're watching this, this might be something that you might want to add to how you address patient care or working up some of your patients, because this is going to give a really clear picture of what's happening inside of your body at like every level. Because then once we get the results from your micronutrient testing, we can see where all the little gaps are. And all those little gaps, all those little things are helping your body to fire and to hum and to run. And many times when we have mysterious symptoms, mysterious illnesses, or things just start popping up or are getting worse and not getting better, more than likely it's related to an imbalance in micronutrients. Something is missing, something is off. We need to optimize some things. And micronutrient testing just lays out the whole picture, and then you can make some more educated decisions based on that. All right. Let me know if anybody's watching. Have you had micronutrient testing done? Let us know in the chat if you had, okay? Now, after we get the results from this micronutrient testing, we're going to figure out what are your goals. Or this is the approach that I take. What are your goals? Like, what are you looking to accomplish and in what time frame? Okay. What is the most important outcome for you? You know, is it energy? Is it sleep? Is it reduced inflammation? Is it your weight? Is it your blood pressure? Is it your blood sugar? Is it just to become faster, better, leaner? Like, what is it? What exactly is it? And then we need to figure out, based on your blood work, based on your lab work, does this really make sense for you right now? Is it a priority for you? Because I've had a lot of clients who have come in with the intention of working on one thing. However, after we run the blood work and get a little bit more in depth, we find out that there's something else that needs to be optimized or something else that needs to be addressed. So say if somebody was coming to me for fatigue, lack of energy, that might be their biggest concern. When after we get the lab work, we find out, oh, well, your inflammatory markers are through the roof, sky high. So we need to get this inflammation under control, and then that will help to fix the fatigue. Instead of just throwing supplements like B12 and a bunch of stuff at energy, we need to focus on the deeper root cause issue then to help you optimize all those other areas, and then that will fix the issue that you're having very simply. Okay? Make sense? Let me know if it makes sense. Drop a makes sense if it does for you. Okay. Now, after we get all of this detailed information, this is where we get to work and we sit down and we really decide and design a custom supplement plan for you based on your lab results, not on Susie's, not on Tim's, not on whoever's, on yours, because it's your blood work, that really detailed blood work that we ran. We're going to see where your gaps are, where you're a little low, maybe where you're high, and where we can adjust those for you. And then it's not even just what supplement you're going to take, but it's how you're going to take that supplement. What route is best for you? And this is a big piece of the puzzle that many people are missing. And again, earlier, as I talked about when I'm doing the assessment, you know, what medical conditions, what surgeries have you had in the past? This is where that comes into play, because if you have had bariatric surgery, for example, or some type of surgery on your intestines, you might need a different route. And IV hydration is a preferred route if you are somebody who has had those types of surgery, because we want to know, should it be a liquid, a pill, a powder, a patch, a cream? What is going to be the best route, the best method to get you that supplement and in the most optimum way, the quickest way, right? Because we want it to start acting, we want to have an impact on it as soon as possible. So we need to keep all of those things in mind. And if you're working with a professional, they can help kind of guide you and decide on which route would be best for you. And again, I always advocate for everybody to look into IV hydration. It is, again, such a preferred method because it gets directly into your bloodstreams, into your cells. There's nothing is lost because of digestion. So you get 100% of what you need right then and there. And you feel better instantly when you get IV hydration. And there are so many different supplements, vitamins, minerals, electrolytes that you can have delivered, mixed together specifically for you. And that's one of the services that I offer through my Viva Hydration Therapy, through my mobile IV hydration. Or if I'm working with clients, I'm having them go out to get IV hydration supplementation. Maybe they don't live here because I do telehealth. So I service people all over. And if I'm sending them out to get IV hydration, I will specifically talk to that place and get them IV hydration custom mixed for them based on those gaps that they might have. So, and also maybe they're getting ready to travel, or maybe they're just having some acute symptoms in the moment, can really help to target that therapy to get them feeling better, get them on their way, running and humming as soon as possible. Okay. And then when it comes to, so it's great. We got our supplement plan and we start taking supplements. The number one mistake that I see when it comes to supplements is people getting super excited, especially with the beginning of the year. And I'm going to tell you this right now. Like, if you don't take anything away from today's live stream, take this away. Because if it's you or somebody you know, do not buy all the supplements and then start taking them all at once, all together. I'm going to tell you why. Because this is the thing that I see all the time, that clients or people that even watch my live streams and that follow me, they will start telling me about all these supplements that they started taking. And it's like, whoa, whoa, whoa. You got to slow down, because you want to introduce supplements, new supplements, one at a time. You want to make sure that you can tolerate that supplement and that you're not having adverse effects from it, whether it's diarrhea, nausea, vomiting. You could be allergic to it. You never know. So you want to go slow, introduce things one at a time. Maybe introduce one thing, take it for a few days, see how you feel. Then you can add the next thing. Then you can add the next thing. I had a girl one time message me, and she just was like making a science experiment in a shake. Like, this girl had like 10 different things in a shake and then was wondering why she wasn't feeling good. And I'm like, girl, I don't even know, because you got everything mixed in there. You got to go slow, one thing at a time. That way you can really pinpoint exactly what's working for you and what's working against you. And I'll even share for myself. I tried to take turmeric. I tried to take turmeric, and I was looking to decrease inflammation. So that's why I was looking at turmeric. And I started taking it, and it gives me the worst migraines ever. I even tried adjusting the doses. It doesn't work for me. Me and turmeric do not mix. Worst migraines, worst headache ever. I just can't take it. But I know that. So if I would have mixed turmeric with a bunch of other stuff, I never would have known what was causing me really bad headaches. So just always go slow when you're starting with supplementation. Just go slow. Okay. And then once you have started your supplementation, you got your stat going, you're doing what you're doing, your health isn't static. It changes as we age. Your hormone levels fluctuate, your gut health, the lining of your gut evolves and changes, your nutrient needs shift as you get older. That's why it's really important to monitor your nutrient level regularly. And I typically recommend every 3 to 6 months monitoring this. Um, and even to take it a step further, If you have things like PCOS, insulin resistance, you're going through perimenopause, menopause, um, underlying inflammation, your blood sugar, how your body responds to food changes over time. I mean, probably something you ate when you were in your 20s is probably not going to be agreeing with you too great when you're in your 40s and your 50s. I know from personal experience. So, wearing a continuous glucose monitor or something that is giving you real time feedback on how your body is responding to foods, supplements, your nutrition, exercise, sleep, stress. That is such a really great way to up level that and to really dial in the supplementation and what you're doing and what you're consuming and what you're doing when it comes to physical activity also. Okay, I'm not going to get into all that today, but just so you know. So if you stay on top of your labs, stay on top of your symptoms, you can adjust those to fit your life stage, your health needs, and really help you to optimize all those um, other functions in your life. And I'll end with saying this. Um, just because there is a supplement out there does not mean that you need to take it. Okay. Because some people feel like they need to be taking like 20, 30. Brian Johnson, he takes like over 100 some pills a day to be healthy. That's his version of healthy. And more is not always better. More is not always better. So you really want to ask yourself when it comes to supplementation, really, do I need this supplement to function well? Is it improving the quality of my life? Right? Because I don't think a really great quality of life is having to take hundreds of pills, supplements, powders every single day. My philosophy is always what's the least amount that I can get away with where I feel healthy, where I feel good, I'm performing good, I'm looking good. What is the least amount? Because I got a life that I'm living. I'm a mom, I'm a business owner, I'm a coach. Like I've got things, I'm a professor, I got things going on. So I need to find a routine, a stack that is going to work very well with my lifestyle. So really think about that before you jump on the supplement train and you're trying this and you're trying that just because you see an ad for it. Okay. Because I already see somebody in the comments. Let me see if I can get these comments to come up. I have, here we go. Oh, where did it go? Let's see. Let me see if I can get this to come up. Is that Linda's comment up there? Yes, it is. Linda says makes sense and not based. Let's see if I can get hers to come up. Show. And me to sell you something based on your blood work. Yeah, supplements. Your supplementation, your body is serious. Your health is serious. Don't leave it to a Facebook ad to decide what you're putting in your body because Facebook is pushing all kinds of stuff out there. So don't rely on a Facebook ad to tell you what you should be taking for your body. Okay. And then Melissa says, this goes for adding things and removing things, dairy, sugar, etc. People always go crazy when it comes to changes and don't know what doesn't work. Exactly. Exactly. Yeah, go slow. Don't make all the changes at once because just like Melissa said, you won't know what is working for you. And that's really the best approach that you can take is when you can personalize it just for you. All right? And one last thing to leave out, one like little bonus tip that I'm gonna end with here in today's video. Um, really look at the ingredients, and I always mention this when I talk about food. I mention this when I talk about food, but especially when it comes to supplements, really read the labels. And I'm going to give you a great example of this. So, my mom is diabetic and she has really jumped on the health train these last few years and she's been doing amazing. She does the IV hydration, she does the supplementation, she's on it with all the things. And she's actually decreased her insulin, gotten off of blood sugar medications. Like she is doing so awesome. I'm so proud of her. But she had decided to start taking B12. and she started taking it, and she was wondering why her blood sugars were like 200, 300. Like her blood sugars were very high, and she couldn't figure out exactly why. So I said, well, what have you started taking anything different? What do you got going on? Let me see what you're taking. And so she pulled out the supplements that she was taking, and I started looking at them, and lo and behold, she had got a different brand of B12. And I turned around and looked at the label, and like the second ingredient, the first or the second ingredient was sugar, was dextrose, some sort of sugar was the next ingredient. And I was like, this is what's causing your blood sugar to go up. She's like, what? She goes, it's the vitamin. And I was like, yeah. Well, unfortunately, in a lot of vitamins, there are lots of fillers, there are lots of other ingredients, but especially sugar, because again, we really want to work as much as we can on decreasing inflammation. And we know that excess sugar is something that increases inflammation in your body. And especially if you're a woman over 40 and perimenopause, you are gearing up and your body is just primed to go into insulin resistance. And actually, 1 in 3 people are insulin resistant and don't even know it. So you could be adding these supplements on that are making your inflammation worse. You could be thinking you're doing yourself a benefit, but you're really not, because of some hidden ingredients that are in there. Okay. So really look at the ingredients on your supplements. Make sure it's what you think you're taking, what you should be taking, and avoid extra things like sugar and some other things in there that are not going to be for your benefit. So just something to look out for. So if that's you, or if you know somebody who is type 2 diabetic or dealing with insulin resistance, PCOS, something like that, pass this along to them. This little tidbit of information. Really keep an eye on your supplements. I know, especially in the PCOS community, people are always talking about supplements and looking for supplements to help with their PCOS symptoms. But actually, insulin resistance is an underlying driver of PCOS. And it's just being not managed well, because not enough people are talking about it from this root cause. They just kind of want to throw hormones and throw a bunch of other medications at it. Not that I'm against medications, there's a time and a place, but how can we make those medications work optimally? What other things can we do on the other end, the more natural end, to make those drugs work better? And how can you take the least amount of medications possible, but still getting the maximum benefit from that? That is the name of the game, let me tell you. Okay. So let me know if you have any other questions. Again, I am live here today, guys. So if you have any questions, let me know. If you ever want to send me a DM, feel free to. If you're watching this video later on and you have some questions, for sure, reach out to me. And again, today I walked you step by step through the protocol that I use when I am working with clients, and they are really wanting to get very detailed precision with their wellness. This is where we start. This is where I start, because I take the time to look at all these individual parts, and I have the time. I make the time. That is what my concierge service is all about. More than likely, you go to your doctor's office, they're not going to be talking about any of this stuff. They're not going to be reviewing lab results with you. They're not going to be customizing anything for you. That's just not how the medical system is set up. And especially if you're a woman, your hormones are changing. There's not a lot of people that are specializing in that. It's very one fits all when it comes to that department. And I am not about that at all. I'm about you personalizing it for you, optimizing it, giving you that concierge white glove type service that you're not going to get at a traditional provider. You absolutely will not. So if you want to learn more about working with me, if you want to get your blood work done, you want to get to the root cause, the answer of why you're just not feeling right, why things are not just working out for you, and you want answers instead of more of, oh, you're normal, I'll see you later on, and you really want results and really want to transform your body, then DM me. Let me know. I can give you some more details about my Bio 90 Reset. It's a 12-month program that I have. It's new, and I would love to talk to you more about that. I have some different entry points for that, depending on where you might fit in, where it feels comfortable for you, and depending on your needs. So if you want to learn more about that, send me a DM, or you can comment on this video if you'd like, depending on when and where you're watching it. But that is all I have for today. And thank you all so much for being here. Love you all. And like I always say,